All right. We shall continue with that later on. Thank you very much. Once again, a very good morning. Please allow me inform you that we are celebrating 20 years of collaboration with Pepfar. This is Joint Clinical Research Center, and you're all most welcome. Please feel at home. Look at your neighbor and smile a bit. Very good. Now, if you don't have a neighbor, just know you have a problem. My name is David Muyomba, and by God's grace, I am the in charge of PR and communications at Joint Clinical Research Center. Allow me welcome a delegation from the embassy. You're very most welcome. Allow me also welcome the delegation from the Ministry of Health. Allow me at the same point recognize the presence of Professor Mujenyi. Who am I to see you? Thank you very much for kickstarting Joint Clinical Research Center. You're very most welcome. Now, to those that don't know Professor Mujenyi, please talk to me very well, and I introduce you. Allow me also recognize the presence of the board members in the house. We are also blessed with the executive director, Miss Dr. Sise Chitio. You're very most welcome. Allow me also recognize the presence of the Deputy Executive Director, Finance and Operations, Mrs. Drola Sevagala. I think you're seated in the wrong... Oh, okay. Please allow me also recognize the presence of my best man, Dr. Sally Francis. Please stand up for recognition. That is Dr. Sally, the director, the Deputy Executive Director, Clinical Services. You're very most welcome. We have the Director, Clinical Services, Daniel Muyanja. You're very most welcome. We have the Director, Laboratory Services. You're very most welcome, Mr. Benson. Mr. Antege, and the rest of the members, you're all most welcome. Sister Masila, please come and give us an opening prayer. And we start.
Good morning, everyone. We're happy to see you. Let's humble ourselves and pray. Lord, our Heavenly Father, we thank you so much for bringing us together for a long time. You've been with us all these last 20 years, and we thank you that you have brought us this far. We want to thank you for our lives, for everything that we have done, for everything that we have gone through. We've gone through challenges, but you have taken us through them. We want to ask you specifically to be with us here as we celebrate these 20 years. Be with each and every one that is sitting here and those who are still on the way coming. Touch them and bless them and give them the life that they need. We thank you so much for all our friends, all our participants in very many different programs that we have had, but mostly we want you to be here with us as we go through this program. So I want to ask for your presence and be with us as long as we stay here. I thank you very much. Bless each and every one and be with us. I ask all this in the name of Jesus Christ our Lord. Amen.
Thank you very much, Sister Masila. And Sister Masila is the head nursing services at Joint Clinical Research Center. Please clap for her. Since we've been humbling ourselves, I now request you to get up a bit and we go through the national anthems. Both the Uganda anthem and the US anthem. I hope the people that are going to give us the US anthem are ready. Canon Gents, I request that you lead us through the Ugandan anthem. Thank you very much.
We lay our future in thy hand, united, free, for liberty together will always stand. Uganda, the land that
Thank you. Let's get the US anthem.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight, all the ramparts we watched was so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof to the night that a flag was still there. Oh, say, does that star-spangled banner yet wave? Oh, the land of the free and the home of the brave. Thank you. My name is Moronji, and he's called Precious. Thank you so much.
Thank you very much, young gentleman. That has been very amazing. Please have yourself seats. Ladies and gentlemen, I want to once again welcome you And I request you to feel at home. We're going to be as quick as possible, and we shall make sure that by 2, everyone is back to their respective workplaces or homes. Right now, I request the acting mission director, together with your team, a representative from the Ministry of Health, the board members, Professor Mjenyi. We take a walk out for a 3-minute exhibition. Then after we come back. For now, I request that the documentary for the rest of the people that are going to stay here is run as we wait for the other delegation to come back. Thank you very much.
ijorebe natamba Yesu natambira bona ijorebe natamba ijorebe natamba Yesu natambira bona ijorebe natamba. Thank you.
Thank you very much, ladies and gentlemen. Those have been, yes, maybe this one. Thank you very much, the Canaan Gents. Ladies and gentlemen, another round of applause to the Canaan Gents. I want to welcome you back from the exhibition, and I really hope you've seen the journey 20 years down the road. It has been summarized in the displays that you've seen, and I believe Jcrc has quite achieved a lot. So a round of applause to the Executive Director for the good leadership. And also a round of applause to Professor Mujinyi for starting up this. I ask the Almighty good Lord to bless you. Ladies and gentlemen, I now humbly invite, before I invite the Executive Director, I introduce myself, David Muyomba, and by God's grace, I am the in-charge PR and Communications at Joint Clinical Research Center. Who am I to MC with the Deputy Executive Director, Mrs. Drola Sevagala?
Thank you, Mr.
Please
David.
do the honors of inviting the Executive Director to come and give her remarks.
Thank you, David, and that was marvelous. I think we deserve another round of applause for the journey we've moved for the 20 years. I think it's not been a very simple journey, but I think we've made it. So big up to every one of you who has been part of this journey. I think amidst us, I would want to recognize in particular the mission team. The mission team wouldn't have moved this journey if it wasn't the mission team. And specifically, I want to recognize Jessica Healy, who is representing the Office of the Health and HIV Director. Just a wave would be wonderful. Thank you so much. We also want to recognize Michelle Lang, who is the HIV/TB team lead, particular. Another round of applause. Dr. Esther Nkolo, who is our current AOR. You know what it means to be the AOR. If she doesn't say you're not doing well, none of us will be here. Thank you so much for standing with us and for coaching us to be where we are. Miss Mary Bagman, who is the Uganda Country Pepfar Coordinator. It can only be her to coordinate all programs. We've moved this journey with a number of partners. We cannot be here to celebrate Pepfar journey if we don't have partners. We have someone representing Muju, Madam Dr. Philpa. We are honored to have you around. We have Ms. Dr. Edward Bitarakate, who is representing EGPAF. We've been in this journey together. Where Jcrc is always Pepfar, and we learn from each other. Thank you so much, EGPAF. We have Baila Uganda, Dr. Dithan Kirangwa, who is representing Baila. Thank you so much, Dr. Dithan. And Dr. Kambugu from IDI. Thank you so much for being here with us. We have directors from the LPHS programs. Lawrence, where are you? That is a gentleman doing wonders in Chigezi. Thank you so much. And where is Dr. Herbert from Lango? Most welcome. Of course, there are also board members amidst us. We did not mention in particular. We want to recognize Mr. Ben Lumu. He's been with us the entire journey of Jcrc, where we started until now. Thank you so much, Mr. Will Lumu, for your counsel, for your strategic direction you've always given us. Thank you. Professor Nakanjako. She's, Madam Professor, we most welcome. Thank you. So I was requested to,
Mr. Counsel, you know, when you're moving this journey, there are always things you need to consult on how things should be done, and none other than Mr. Maseliji. Kindly recognize. We are honored to have you around. So I think at this point, we want to invite, so Dr. Sisi Chitio, who is the current ED of Jcrc, and we want to appreciate her leadership and her guidance she has always given us. We are honored to have you. Thank you.
Thank you, Drola, for the introduction, current and future ED. The acting mission director, the Pepfar country coordinator, Dr. Olalo, director clinical services, who is representing the Minister of Health, USAID team representatives, who include our AOR, CDC representatives, Stella. We used to work with you when you were in Imbuya. The Jcrc board, all our partners, not all of them are here, but they've already presented you. All our, our partners are also the patients that we look after. So those ones representing our patients here, you're most welcome. And all of you, Jcrc staff, of course, then ladies and gentlemen, it is with great pleasure that I welcome you to this gathering when we celebrate 20 years of Jcrc successful collaboration with Pepfar. Jcrc was established in 1991 to provide a scientific solution to the dire HIV situation in the country at the time. The center started to provide antiretroviral drugs from 1991 through operational research, sponsorship programs, compassionate basis, and a cost recovery program. The cost of ART was very high, but it came down dramatically after bulk importation of generic ART by Jcrc from Sipla, India in 2000. The center then developed a network model for cost-effective and rapid scale-up of ART treatment, which is applicable in resource-constrained countries. Correspondingly, the numbers of new patients taking on ART escalated because of the low cost of ARVs. However, these numbers only rose to about 13,000. But we had so many people who already had HIV and were actually dying. So in this process, the Jcrc established a network that was ready for ART rollout. And then the center became a case study for Pepfar architecture and approval. The center subsequently received the first Pepfar grant in the world through USAID in November 2003. Jcrc then managed the first country-wide public sector program for provision of ART under the timetable for regional expansion of antiretroviral therapy, which was called the TREAT project. And we initiated over 100,000 HIV patients on life-saving treatment. The achievements of Jcrc Pepfar collaboration are numerous, and some have been highlighted in the exhibition. If you have time, you can look at this. But we couldn't present everything. 20 years is a long time. But this support to accelerate the Jcrc work at the time goes beyond the institution to cover the country. This is the Pepfar support, and many other low and middle income countries. Uganda now has 1.4 million HIV patients, with over 60% supported by Pepfar. So we are most grateful to Pepfar for enabling us to make these achievements, and most importantly, save many lives. We acknowledge the tremendous efforts by our previous executive director who has graced this occasion. For facilitating and enabling Pepfar to happen, and spearheading the Pepfar program at the Jcrc and in Uganda. So for us who have preceded him, we stood on very tall shoulders to get where we are today. We are still moving. We thank the Ministry of Health, under whose mandate we work, for all the support that they have accorded us as we worked in the public sector to improve health service delivery in the country. We will continue to work under your supervision and guidance to contribute to better health care in the country. The partners who are represented here and others who may not be here, who have complemented and enhanced our work, we are most grateful. I thank you all greatly for complementing Jcrc work and contributing to providing comprehensive care to patients in Uganda. This work would not have been possible without the support and guidance from our Board of Trustees, the past and the present, who continue to show their commitment by being here today. That's the first commitment. We value you greatly. The whole staff of Jcrc has been pivotal in the successful implementation of Pepfar program. Because if Professor Mujenyi brought this program and the people on the ground were not doing a good job, we would not be standing here to say we have achieved a lot. And the staff are represented here by the deputy directors, and departmental and section heads. We thank you for your leadership and engagement. Having resources does not automatically translate into successful implementation. No, as we have seen with some projects. Jcrc has continued to do research that has saved money for drugs that we would have used from the Pepfar grants. I think we are not communicating very well, but it's a lot of money from our research contribution. Some of this research has yielded results that have actually revolutionized the way we treat HIV/AIDS today. An example is test and treat. Jcrc was one of the sites in that study. New formulation for children, and these have been adopted by FDA and WHO. So as we move forward, because we are moving forward with Pepfar, maybe for another 30 years, 50, we will continue to work with Pepfar to get to epidemic control, because that is the immediate goal. And when we achieve this by 2030, there will still be need to provide ART to sustain the epidemic control, isn't it? So we need to address, and we still need Pepfar support. We will need to address the HIV epidemic with new interventions like long-acting ART, and we are already conducting that research. But we also need to cure HIV, and we need partnership with you as we do the research, so that whatever becomes efficacious, you can support us to roll it out. We look forward to working with Pepfar to end this HIV epidemic. Thank you very much.
To our ED for making those statements. I think those are not simple statements. We appreciate the pronouncement that we are here to continue to end the epidemic, and the statement that the mission is here. All of us are here. It's a great statement that we are going to achieve.
The other thing that I've really wanted to note that ED has echoed: give us the resources. We assure you that we are going to use them appropriately in a very well organized manner. We are here to save lives, and we are here for a good cause. Thank you very much, Edie, for those very wonderful words. Ladies and gentlemen, right now, allow me.
So at this point in time, we want to invite the board chair. Professor Ibinjira is not here today, the chairman of the board of trustees, but Mr. Luumu is going to be able to represent him ably. Please join me to welcome Mr. Luumu, one of the longest serving board members at Jcrc. We salute you and we appreciate your counsel and your guidance. Thank you so much.
Thank you, MC. I've already been introduced. I am reading this speech on behalf of our board chair, who has been unable to come here. Ladies and gentlemen, the acting mission director, the Pepfar country coordinator, the USAID team and representatives, the CDC representatives, the Director General, Uganda AIDS Commission, other distinguished guests, all protocol observed. On behalf of the board chairperson and the entire Jcrc board, we take this opportunity to welcome all of you to this great day as we celebrate our 20-year partnership and journey with the Pepfar. This year, Jcrc celebrates 30 years of Jcrc existence with the theme 30-year celebration of excellence in research, clinical care, laboratory service, and capacity building, of which the 20 years we have enjoyed as a result of the contribution from the partnership with the Pepfar. We would like to applaud and appreciate His Excellency the President of the Republic of Uganda for being the vision bearer and for his foresight and taking the step to establish this great institution. The vision and the mandate were for Jcrc to come up with a scientific solution to curb the deadly and awful disease, HIV, at the time. Over this period, the Jcrc has implemented several projects under Pepfar support, mainly through USAID and CDC. The journey started with the treat program, timetable for regional expansion of antiretroviral treatment under an emergency mode to address the HIV situation at the time. This was at the time when no one in the world believed that ART could be administered in a small third world country like Uganda. We would like, therefore, to applaud the able leadership of Professor Peter Mujenyi, the past executive director of Jcrc, who stood firm and believed in the team to be able to manage the program. The center received subsequent funding from Pepfar, including the targeted HIV/AIDS and laboratory services Thalas project, supported strengthening of the laboratory infrastructure and network in the entire country. The IDI CDC Kampala HIV project and the local partner health services, Kabale and Lango, which has consolidated gains in these regions to work towards HIV epidemic control. This has contributed to saving many lives of Ugandans. The strengthening of public health laboratories project works closely with the Ministry of Health to strengthen laboratory systems and establish sustainable diagnostic optimized networks and partnership for integrated HIV-related testing, disease surveillance, and outbreak investigation in Uganda. With this funding, Jcrc is currently taking care of more than 160,000 clients on HIV treatment with great achievement. The Joint Clinical Research Center has been pivotal in guiding and informing HIV and TB policies nationally and internationally through pioneering research and clinical practices. Jcrc is also known and shall continue to be a key pioneer and a market leader around research and clinical care. As a board of trustees, we would like to appreciate the US government and the American people for the support accorded to this country, Uganda. We have moved miles because of the support from the American people. Thank you for trusting and believing in Jcrc to do this job. We would like to applaud the Uganda government, especially His Excellency the President, for being a good and foresighted leader. We would also like to appreciate the Ministry of Health for the continued support provided through provision of policy guidance and strategic guidance. As the board, we are still committed to steering this noble cause and to provide all the necessary strategic guidance to management to ensure that Uganda continues to benefit from this support. I would like to appeal to the American government to continue supporting Jcrc, as the ED has already also appealed, so that we can achieve the targeted epidemic control and maybe up to HIV cure. To the people of Uganda, I would like to reassure everyone that Jcrc, as a local organization, is here to provide quality and excellent services and will adhere to this noble cause. We do look forward to continue working with everyone to achieve an HIV/AIDS-free world. Congratulations to Jcrc Uganda and the American people for reaching this great milestone. I end here. And I must say I've enjoyed standing between these two flags. Thank you.
Thank you, Chair, the Board of Trustees. And indeed, it's a privilege to stand between these two flags. Even me, I already enjoyed it. Thank you for the statement made. I think another round of applause for Mr. Lumu. Indeed, we couldn't have moved the 30 years of Jcrc if Pepfar was not there. So the 30 years includes 20 years of Pepfar journey. And so another round of applause for the Pepfar. Indeed, we need to thank His Excellency, the President of Uganda, for believing in Jcrc, for the foresighted vision that Jcrc could actually come up with a scientific solution. We are still on the journey, but I think we are getting there. We must get the cure for HIV. Indeed, Professor Mujenyi, we couldn't have gotten here without your first step. Thank you for taking the baby step, and thank you for the affirmation that the team in Uganda could actually do it very well. Could you just imagine where the 160,000 patients we are talking about could be if it wasn't for all of us, if it wasn't for the contribution from the partners here, if it wasn't for Pepfar support. Round of applause for each one of you, and please pat yourself for the contribution made. So at this point in time, we are going to hear it from the horse's mouth. People have been actually benefited from this support, and we want to hear testimonies from beneficiaries of this Pepfar program. We are going to have an expert client, and when we say expert client, these are people who have lived with HIV, and they've come to it, and they're actually giving counsel to others on how to better their life, even with living positively. We are going to also to have Gloria, one of our babies. We are proud of her because we saw her when she was a baby, and now she's here to speak about this journey. And we're also going to have an HIV advocate, Flavia. So I'll give an opportunity to each one of you for 2 minutes to come and give us your experience. Come forward. Thank you. Yeah, I think we can start with William, and then Gloria, and then we shall end with an advocate. 2 minutes for each one of you.
Thank you very much. I'm glad to be here today. My name is William Matovu, commonly known as the UE Kozu guy, and I work with Jcrc as a focal call center peer. Let me give you a question. Can you imagine someone is now 29 years but began treatment at 14 years? Who is that person? Of course, I'm me. Are you together? I'm me. I began treatment when I was 14 years, but it was really a hard time for me because I used to stay with my stepmother in Kasangati. Dr. Victor can witness that, and some other people. It was really a very hassle for me to begin treatment, but through the help of Jcrc team, I began treatment, and I was initiated on ART in 2008, 21st of February. So I can never forget to recall that day. But before my diagnosis, let me pose again another question. How do you know that? How did I acquire HIV, first of all? How do you think? How did I acquire HIV? So, personally, I acquired HIV through my mom, but I knew it by myself after the death of my parents that I'm living with HIV at 14 years. But it is, as I've told you, that it was really a hassle for me to know because my stepmother had failed to take me to begin treatment. But because of Jcrc, I'm a living testimony through the collaboration of Pepfar. I'm an advocate living with HIV. I'm open living with HIV. I've worked with different peer support groups in Uganda, and I'm a global advocate. Thank you so much, ladies and gentlemen, for giving me this opportunity to testify about how Jcrc and Pepfar has really done a tremendous work in Uganda and other parts of Uganda. Thank you so much. Be blessed.
Thank you so much, William. Indeed, it feels great to stand in the middle of these two flags. Good morning, everyone. All protocol observed. My name is Nawanyaga Gloria. I am a young person, born and living with HIV. I am an HIV advocate. I am a human rights lawyer. I'm the founder of GILO, Young Positives Foundation, which is a youth-led charity organization that empowers, equips, and educates young people, both infected and affected with HIV to improve on their livelihoods and well-being. I'm also the founder of the Y Plus Music Band, which is a band of young people still both infected and affected with HIV, and we use our talents to create a positive impact through entertainment. I'm so happy to be here, and I want to thank Jcrc and Pepfar for giving me life, because if it wasn't for Jcrc, thank you so much. If it wasn't for Jcrc, if it wasn't for Pepfar, I would not be standing here today. Thank you, Pepfar, for supporting all the HIV programming. I will say, can I say all? Can I say all? Hope that is okay. The HIV programming, when it comes to HIV prevention, care, and treatment and support to help us live better lives. I got to know about my HIV status when I was 11 years. And I vividly recall my mother asking me, what do you know about HIV? At that age of 11, what I knew about HIV is HIV kills. And everyone who has HIV is going to die. So she asked me, what do you know about HIV? In my mind, I knew HIV kills. So she asked me then, what will you do if you find out that you're HIV positive? Because I would always ask her why I'm taking medication. By that time, we used to be on Septrin before I think policies changed, because now everyone who tests positive is started on ART immediately. So I was taking Septrin, and I would always ask her, why am I taking this medication? Why are you always taking me to hospital for checkup? So at first she was afraid to tell me, but later on I think she knew that I'm growing, and I'll definitely get to know. So she took me somewhere, and then she popped up that question of what do you know about HIV? And as I said earlier, I told her what I know about HIV is everyone who has HIV is going to die, because what I knew is HIV kills. So she felt very frightened, and then she asked me, what will you do if you find out that you're HIV positive? At that time, I didn't answer her, because I tried to connect the dots of me going to hospital all the time, me taking medication, and her asking me her asking me about HIV, and I got to know that I'm HIV positive just like that. And at that moment, I knew I don't have a future. I knew I'm going to die. I knew I'm not going to be able to achieve my dreams. And I hated myself. I hated them. I started judging my parents, but I'm glad that I realized that it's not their fault, because my mother used to always tell me there is no parent who would wish bad for their children. And now she's actually one of my biggest supporters in the HIV advocacy that I do. Thank you so much. I faced a lot of stigma while growing up, but because I was given 2 minutes, I might not share my whole story, but I faced a lot of stigma while growing up, and it even forced me to run away from school because of the stigma I was facing in school. But nevertheless, I'm glad that I overcame the stigma, I overcame the self-fear, I overcame the self-judgment, and I'm here today sharing my testimony. When I was at campus at Uganda Christian University in my law school, first year, that was a very unfortunate time. That it's the time my father passed on. May his soul rest in peace. And at that time, we were financially struggling at home. And because we were financially struggling at home, my parents could not afford for me to be at school and afford all my needs at school. So I met this girl at university, and she saw me, we became friends. She was like, oh, you're a good person. Can we be roommates? I was like, it's very okay, we can be roommates. So we started to be roommates, but little did I know that me being with her would be a turning point, and I'm going to tell you how it was a turning point. So she didn't know about my HIV status, and we moved in together, but because at home we're financially struggling, she would provide for me, she would buy the food and everything in the room. So time came, and I think maybe she felt entitled since she was providing, and she had a boyfriend, and she asked me, can I bring my boyfriend to stay with us? It was weird and awkward, right? But since she was buying the food and everything, how can I say no? So the boyfriend moved in. But sometimes, as you know, some men can be funny. So the boyfriend picked interest in me, and he came to me and told me that, Gloria, I think I like you. I'm like, are you crazy? I mean, your girlfriend is my roommate, your girlfriend is my classmate and my coursemate. How can I? So this gentleman, before even him moving in, he would see me take my medication and he would ask me, why are you taking that medication? And I would tell him that sometimes I have headache, I have stomach ache. I would not tell him the truth because I wasn't open about my HIV status. So here comes, he's staying with us, and he picks interest in me. He comes to me. I tell him I cannot do that. So I think he made the guilt into shame, and because he had access to our room, he went in my room without my knowledge and without my roommate's knowledge, and went in my suitcase and searched for my medication and my medical form and got to know that I'm HIV positive. And he went to the girlfriend and told the girlfriend that I was seducing him to infect him with HIV. It was so sad at that moment, and I could not, hold everything that was happening. He decided to run away from school again. Remember, this is university. So, but while I was where I ran to, I talked to myself. I told myself, Gloria, is your HIV status going to change? No. People have to change the way they see us. People have to change the way they look at us. Our HIV status is not going to change, but people's attitude towards us can change. People can start supporting us for who we are, can start loving us for who we are. So I told myself, Gloria, you're a bold person who doesn't run away from problems, because bold people don't run away from problems. So I decided to go back at university. Amidst all the hate, because my roommate had started spreading rumors at university and at campus, how I'm this girl who wants to infect, HIV to everyone. So when I went back to a hostel, immediately my roommate saw me. She had to pack in the middle of the semester that she cannot live with someone who is HIV positive. Yes, so she had to leave me in the room because I was HIV positive, and she thought that I'm this bad person who wanted to go on infecting everyone, even after sitting her down and explaining everything. And of course, rumors had spread. At that time, I had no friends. I had no one to run to. I had no one to talk to. And what I resorted to is to concentrate on my studies. That was at university. And I can tell you, when I concentrated on my studies, I was the best in that semester. Thank you so much. But also, one day when I was in the room, locked myself because I was staying alone. After all, my roommate had gone. I was like, what can I do to prove these people wrong? What can I do to show them that even someone who is HIV positive can be someone in life, can do great things and mighty things? I went on Google and I researched about the Y+ beauty pageant. I don't know if we know about the Y+ beauty pageant, and I decided to contest for the Y+ beauty pageant. We went for auditions, went to Fort Portal for the boot camp, and we came back in Kampala at Hotel Africana, and in 2017, I was crowned as Miss Y+, 2017-2018. Thank you. And my journey for advocacy started from there. I started representing young people at both national and international level. I started being the voice for the voiceless. I started advocating for the rights of young people living with HIV, advocating for meaningful involvement and engagement of young people, advocating for SRHR, and, so many different things that I advocate for. But I also didn't stop there. I was nominated to be on the youth board for ICASA, which is the biggest conference in HIV that organizes the biggest HIV conference in Africa. I believe we all know ICASA, and I've also been serving there on the youth committee for now, I think 4 years. And I'm also part of the young representatives at IAS, the International AIDS Society. And I'm also doing a lot of work in empowering, educating, and equipping young people, still both infected and affected with HIV, in my organization, which is Gilo Young Positives Foundation. And as I speak now, we have empowered over 1,000 young people. Thank you so much. I believe that we young people, what we need is, first of all, education. education is very important for us young people living with HIV, because I believe that if we are educated, we'll be able to be part of the HIV response, both at the national and global level, just like I am. So I am sponsoring 10 young people to go and access education, but I'm also supporting over 50 young people with different scholastic materials and helping them to keep in school so that they can be part of such discussions, so that they can be part of, the HIV response. And I believe that since we all know the statistics that it's mostly young people who are highly affected when it comes to the HIV response, we need to bring young people on board. We need to engage them. We need to meaningfully engage them and involve them in the HIV programming, starting from the designing, the planning, and the implementation. We need young people on board because we believe, as we all hear, some of us, that there is nothing for us without us. So please engage us as young people in all interventions of HIV. We have great ideas, we have great minds. Bring us on the table and we share those great minds with you. And we believe that if we work together in global solidarity, we'll end AIDS by 2030. Thank you so much.
Good morning, ladies and gentlemen. This is my 20-year harvest on art from 2003 to 2023. The Uganda government representatives, the acting mission director, US government, Pepfar representatives in the House, CDC, implementing partners, Jcrc, IDI, MUJU, communities of people with HIV, and I beg that you stand, that people see you. The people with HIV in this room, please stand. If you don't have any face to lose. Thank you for coming. Ladies and gentlemen, my name is Chomkama Flavia. I work as Executive Director of Action Group for Health, Human Rights and HIV. I also coordinate the Women at 40 campaign. The Women at 40 campaign is a national movement of women living with HIV for national networks of women living with HIV. And why we come to be is because we realize our girls we delivered HIV negative are getting HIV and delivering HIV positive children. And there is an increase in vertical transmission. And so we are concerned. But aside from that, I'll share my testimony. Gloria reminds me of my son. He was also a member, a patient from Jcrc who passed on 2016 of lymphoma. And I also realized that William is also my son. I am 54 years old, and I learned I was HIV positive when I was 24 years old. I was in a relationship, and how I knew is that I had TB. So I went to Mulago and I was diagnosed with TB. But then the person there told me, oh, you also have HIV. And he said the way to qualify to take oral TB treatment, which was then a trial by Case Western Reserve and Nagasaki University then, was that I was HIV positive. That was the reason I had to initiate on oral TB treatment. And so I am one of the people that went on trial for TB, the isoniazid, and rifampicin. So that was in 1994. And so I thank myself and everyone that we have been able to move this far to ensure that we have oral treatment for TB. At that time in 1994, little was known about HIV. And I had lost 2 children, 3 in fact. I had lost twins in 1989. I lost another in 1994. And that's when I knew I was HIV positive. At that time, we had heard about Phil Taya, and it was like, this guy is looking for money. But when his hair started getting off, we thought, oh, this is serious. I do recall at that time, even before we knew our test, some of us tested the Nanyonga soil from Masaka, because we were thinking if we had HIV and the soil could work. People brought and we shared. During that time, in the mid-1990s, 98, 95, 98, we had conferences and representatives from this country went and learned there were life-saving medication. The likes of Major Ruranga traveled, and they heard that communities were actually having some treatment which could push their lives ahead. So we kept in hope. And at that time, people who die in the US, in the UK people would share the leftovers. We actually lived on Mivumba. A number of us were living on second-hand medication from the US, from UK. If people died or were switched to better drugs, then that medicine, we would find some way through activists to deliver it to Uganda so that some of us could live. We have many testimonies. I didn't take that medication, but I know the likes of Major Rubaramira, Jane Mirumubi, Canon Gideon, Beatrice Were, they brought medication. If it was for a month, they would share 1 week each so that each one could live ahead. And the few I'm mentioning are alive, but very many died because they could not afford the medication. We heard of Cameron, we had Stavudin. I was just sharing that whenever I'm on TV and I'm watching and I see people, I indicate this one is a Stavudin patient and this is a classmate. So we had those cases at that time, but some of us could not even afford. We thank God that during the year 2003, the government in partnership with Pepfar came with a trial. And they needed at that time 6,000 people. And we were only lucky to be enrolled. We came scrambling. By the way, those forms, Sister Dina, you are giving us, we didn't even read to consent to say we have understood what was there. For us, it was life. It was just giving ourselves there because we needed something to push us another day. For 8 years, Pepfar funded this program. We took the treatment, and we are glad that it has become efficacious and is rolled out throughout the world. We do believe that without Pepfar, a number of us wouldn't be alive. I know we lived up to 2003 because we had positive living groups and clubs like Nakola, like Filial Retire Initiative. We had TASO. Unfortunately, those clubs that worked, that mobilized us, that gave us the hope, that showed us examples, have since waned. We don't see that kind of action now. But why is it? We had the test and treat, and everyone who would come would be enrolled on treatment, just like Jcrc has talked about it. And I know by far Pepfar is the biggest supporter of ART in this country. So when ARVs came, when these ARTs came and were rolled out, people thought ART is the end of the world. And we have seized those things that were happening. But I'm glad that Jcrc, with support from Pepfar, they continue to provide counseling support. They continue to do the lab testing. They continue to give us the holistic care that we expect and that we are aging. I knew I was HIV positive when I was 24. Now I'm 54. That is 30 years later. We didn't think about we would live up to today. And so we are grappling with aging. And we are aging with HIV. And then we are aging on art. So we are also glad that Pepfar has brought on board inclusive and integrated financing to ensure that we are looking at how to deal with non-communicable diseases. I am a survivor of cervical cancer. I did surgery, radical hysterectomy 2 years ago because I was having cervical cancer. It is something that we rarely talked about. We rarely talk about. And the diseases of the aging, people haven't been talking about them. In fact, if we discussed ART in light of menopause and andropause, many of us have not even synthesized to know what the implications are. We know menopause and andropause have their own implications on our bodily phenomenon. But supposing we incorporate art, what is the mix? How do we manage it? And these SRHR issues of ours, for the young ones who are trying to get in relationships, who are trying to grow up, it's difficult for them to disclose. But it is also difficult for those of us who have grown above 40 because our government programs are mainly looking at reproductive health for 14 to 49. So we thank you, Pepfar, because you are continuing to risk the resources to go into unworked on or an untraveled ground to ensure that you bring us a good life and good health outcomes. We would like to thank you, Jcrc staff, led by Dr. Sisi Chitio and Dr. Mujenyi. We are glad that you are here to see Jcrc at 30, a baby you birthed. And we would like to say, you have moved the ranks because of these programs. You have become professors. You have become associate professors, nurses. But for us, we have seen life. We have got dignity. It's not about the ranks, it's about life. The life in the years we have got over these years. We thank you for doing the great work you did. But we also implore you to thank us for giving you the opportunity to serve us. Because if we hadn't lived, I don't know where some of your accolades would be coming from. So we are part of your lives. We put food on your table, and you also give us a life. So we thank you very much. We also would like to thank the government of Uganda, represented by Dr. here, for the good work, the good policies, and the continuing evolving policies and programming, and that now we have even a stigma reduction and prevention guidelines that we can use as we do our HIV programming. But what we call upon is that we need now to look at HIV in a holistic manner, not look at it as a parallel program, but as part of the entire health programming framework. Because where we are going, we realize HIV can no longer be managed alone, but has to be managed in a continuum. Our call to action is that, what I didn't tell you is that I'm one of the founders of the National Forum of People Living with HIV, which is also 20 years today. So we would like to implore you to give us some resources. We have got a home, and Tasso has said it's giving us a home, but at a fee. So it's a call to you all to invest in this home. It is in Jcrc. It is only 360 million, and we are calling upon you, all the partners here, the development partners, the implementing partners, that please contribute to this home. Now, Fofanu has made us, and we have made sure that the HIV transmission reduces on a grand scale. We look forward to investment in integrated multi-sectoral HIV programming to ensure that we meet the different health needs of people with HIV, the TB, SRHR, the non-communicable diseases. And I'm glad that Pepfar investment in Jcrc is even bringing more investments in developing new HIV technologies, the injectables, the tests for the calcium, I don't know, what do they call that machine, that we are now able to go and see what our calcium density is like, and then we are able to be switched, which was never there before. We also want to thank you for investing in the new scientific innovation of the stem cell transplant, which is one and rare in many countries, and we are glad that Uganda is one of the implementing partners of that research. We'd like to implore you to invest more in reduction of the incidence of HIV, especially among the girls and young women. No one is more infected and affected by women and girls, and we believe we should target our investments now to our young women and girls who are getting infected and delivering HIV-positive children, and that means we cannot end AIDS soon. We also would like to see more inclusive policies and programming, especially to ensure that we see less than 10% stigma and discrimination, targeting the people with HIV and affected families, that we see less than 10% sexual gender-based violence, which is one of the drivers of HIV in this country, and we would like to see less than 10% of the laws in this country being punitive. And we know our HIV policy, and I mean the HIV law, has clauses that we have said need to be removed because they create more distance for persons with HIV to come to the fore. But we also know the AHA has its implications on access to services. And we know if people are driven underground, we shall have more infections in this country. And yet, we are saying we want to end AIDS by 2030. we above all implore you to invest more in community systems, because the 200,000 people living with HIV who are not yet diagnosed require that communities, ourselves, look them up from where they are, because they trust us. And so we would like to see, following the UNAIDS targets, that we have 30% of financing happening going to community institutions and systems. And 60% of programs being delivered should be delivered by communities, because we know where it is, we can link to the government infrastructure, and 80% of these communities, of these monies and investments and programs, need to be led by communities. And it doesn't have to be people with HIV, but communities of religious leaders, communities of disability, people with disabilities, communities of women. We need to put people and communities at the center of all programming. And we thank the Ministry of Health that they have realized that communities are important. And only this year, they launched the National Community Health Strategy. And we believe if we go that route, we are going to end AIDS by 2030. I rest my case. Thank you very much for allowing me to speak.
I think I can't add any more. They have said it all. And the key point here is we've given them life. You've given every one of people living with HIV life. So thank you so much for your contribution. And Jcrc, thank you for the holistic care that you provide to people with, living with HIV. The next, I think we are going to have some little entertainment from Stigmaless Band. These are also our own as Jcrc, people who are the children we've raised from almost childhood, and they're now able to provide advocacy and provide guidance in terms of how to manage stigma. This is led by Supercharger, one and other than. Please welcome them on stage.
Thank you so much. Ladies and gentlemen, I'm called Moses Supercharger. I'll not talk so much about myself because my colleagues have talked to, have given the testimony. I don't think you need too much testimonies. I'll just do the entertainment. But briefly, I'm a person who has openly lived with HIV since 1994. And like you can tell, I look good, isn't it? And if you're asked to identify the 5 most good-looking men in this room, and you bring that list without my name, you'll be in trouble. You have failed the exam. I'm looking good basically because of Pepfar. Can you put your hands because of Pepfar? I mean, I experienced HIV drug resistance in 1998. And I was carried back home, Nakasongola, 150 miles, to be buried. I was only saved by Professor Peter Mujenya and Dr. Sisechitiu and their team in the year 2000. When they tested, they realized I had developed resistance. Why did I develop resistance? Because I was not taking my medications correctly. And why was I not taking my medications correctly? Because I could not afford. I used to buy medications $180 every month at that time. And I couldn't raise that money. So I revised a system. As a brilliant man, I said I will buy medications for 1 month and superuse them for 3 months. I could take for 1 day, skip 2 days. Take another day, skip for 2 days. I didn't know that actually there was a consequence of developing resistance. I developed resistance in 2000 and my relatives carried me back home for burial to wait my death. I have a very great and bigger story. It was even captured by BBC. It's called Traveling Home, next to my coffin. You can Google it and listen. But one of the things I'm proud of, in the year 2000, when I went through resistance and resurrected by Joint Clinical Research Center, I formed a group called Stigmaless Band. At that time, they were young babies. Look at them. Most of them have graduated. Beautiful. They even go to international conferences and give speeches. Why have they been able to do all that? Because they access treatment and use it correctly. Can they afford to buy the medication? No, but because of Pepfar. Pepfar will love you. Lastly, personally, I thank Pepfar so much, and I want to support your initiative everywhere. We know that 1.4 million people are on treatment, but there are some 80,000 who are not virally suppressed. Why are they not virally suppressed when the medications are there? They pick the medication but don't use them correctly. Why? Because they lack the information. They don't know the importance of these medications. It's not the doctor to give them that information. It's not Pepfar to give them that information. It's me, Supercharger, the person who knows the importance of this medication. But I can't do the job without support. So we need support to carry the information to the communities about the importance of these medications. It's because of that, 8 years ago, I started constructing what they call a Jcrc Prevention, Treatment and Research Literacy Center at Matuga, sitting on 3 acres. We are officially opening the first phase of this center on the 9th of November. I've invested over $120,000 in this project. I failed to get support. I tried to look around, I failed to get support. I said I can do it, slowly by slowly, phase by phase. So we are opening the first phase on the 9th of November this year. I'm inviting all of you, and we need support. I'll be hosting over 500 people living with HIV, and special friends of mine will be there. We need support to accommodate this function. This center will be able to educate people with HIV about the importance of this medication. It will train the superchargers to pass medication, to pass information to people living with HIV so that they can learn about the importance of this medication. People pick medication and then just throw them there because they don't know actually that this medication even benefits their partners. They don't know that actually this medication even benefits their unborn babies. Sorry about, but if I get chance, I'll play this song again without those interferences, technical interferences. Thank you so much.
Thank you very much. The Stigmaless band that is led by none other than Supercharger. Ladies and gentlemen, another round of applause. Because we don't want to waste a lot of time, I request that we go to the next agenda, and that's the keynote address from Mr. Anthony Fauci. I think the technical team is set. He's with us virtually. So I request that you listen to a message that he sent us keenly. Can we add the volume?
Which 20 years ago, in the first grant recipient of the Pepfar program, was at Jcrc under the leadership of Sissy. Greetings, everyone. This is Tony Fauci here from Washington, D.C. I want to take this opportunity with great pleasure to congratulate Peter McGenye, Sissy Kitcho, and their colleagues at the Joint Clinical Research Center in Kampala, Uganda. This is now the 20-year celebration of Pepfar, which 20 years ago, in the first grant recipient of the Pepfar program, was at Jcrc under the leadership of Sissy and Peter. I can remember very, very clearly when I came to Uganda more than 20 years ago to look at the possibility of developing a program according to the direction of President George W. Bush that was both transformative as well as accountable to make a major, major impact on the treatment, prevention, and care of HIV in Southern Africa, including in Uganda. I was inspired by what I saw at the Jcrc, and it convinced me that if enough resources were put into play, that we could have a program that could turn around HIV in Southern Africa and in other developing regions of the world. I went back to the United States and I made my presentation to President George W. Bush, and to his great credit, he asked me and others to put together the architecture for the Pepfar program, which now, 20 years later, has been responsible for the saving of 25 million lives. And again, going back to my first impressions here in Africa, it was the interaction that I had right here in Uganda with Sissy, Peter, and their colleagues that played a major role in convincing me that this was feasible and should be done. So again, congratulations on your 20th anniversary of that first Pepfar grant that you received. Thank you.
Thank you very much for that very nice message. Thank you very much, CC and Pere, for being the leaders that you've been. Ladies and gentlemen, next on stage, it is with great honor that I invite Professor Mjenyi to come and also address us. I hope the presentation is also ready. Ladies and gentlemen, another round of applause too. And let's have the lights off. Thank you.
For advancing the slides. You promised me to have a slide advancer. Thank you. The host, ED, Jcrc, Dr. Sisechitio, and the board, thank you for inviting me to come back here and share in the celebrations. First of all, I want to say congratulations. Is when some leaders leave organizations, they collapse. At Jcrc, when leaders leave organizations, they advance. They actually shoot up. So congratulations. Acting Mission Director, thank you very much for being here. USAID, CDC, heads of the collaboration fraternity, I've seen all of you. We value you, and thanks for the help you gave me before. Colleagues at Jcrc, it has been a great pleasure to reunite with you and to find you in high spirits. Thank you very, very much. Well, one of the biggest presents I have had today was to find that part of what I'm going to present is already been presented. And this is not a surprise because we are telling the same story. But perhaps I should start by a dedication. Among the people to dedicate this talk to, he has already given his keynote speech. But since I will be skipping most of the slides, maybe I should tell you a story way in advance of what is going to be presented to you. About 3 months or so before President Bush announced the Pepfar program, I was taking some Canadian friends to have a look at one of our national parks, which was a rare privilege for me because I was always busy and they gave me an opportunity to do so. Then Tony was on the phone, and this is what he said. He said, Dera, I want you in Washington immediately. I asked him to define what immediately meant, and he gave me a definition, like yesterday. Then Eric Guzbe was in the transit at another airport. I think he was in Nairobi. He was going to Brussels, and they announced over the loudspeakers, they say, Eric, you are wanted at the airport coordination. He wondered what is happening here. When he arrived there, it was Tony Fauci. He said, Eric, I want you in Washington immediately. Cancel whatever you are doing. It's so important. Come. Then William Pape was about to go and give a lecture, a talk in some mission in America. Tony Fauci told him, come to Washington immediately. And Paul Farmer was working in Haiti. Paul Farmer recently died. He was working in a place called Cange in Haiti, and he was told to be in Washington immediately. So I went to the airport, and Tony Fauci had told me, if you don't have a visa, just go to the plane, they will allow you to board. Well, I had a visa. I didn't test that. So this is why I'm dedicating this talk to these people. With the exception of Fauci, the rest of us have been variously described as a gang of four. And Paul Farmer himself used to describe us as co-conspirators in the fight against HIV/AIDS. When I arrived in Washington, we met the next morning, all of us. I had no idea why I was being called to Washington. And my colleagues didn't know either. When we arrived at the West Wing of the White House, we had one question which we had been called to answer. And the question was this. You know, guys, the best experts in the world on health are Americans. And the advice we are getting is that HIV treatment is impossible in Africa. And there are various reasons why that is impossible. But you, especially Mujeni, you have been going around saying treatment is feasible. And the question we want you to answer is, why is it that the experts are saying it is not possible, and you guys are saying it is possible? We have called you here to answer that question. But I will not pursue that anymore because the rest is history. What I can say, however, is that it has been a long time. That is a long time, and some of the people here were not even born or were children when all of this started. But the first case of AIDS was identified in 1982. You have seen those pictures, and in this country it was called slim disease. And I don't need to explain why it was called slim disease. You can see it yourselves. Some of the people now don't even know that it was slim disease. We had the first publication by Ugandans, including Serwada, Mugerwa, Sewankambo, in 1985. For the first time, it linked slim disease with HIV. People had thought it was a different kind of disease. As Sise has explained, this was the place that was allocated to Jcrc to start looking for a scientific solution. Actually, that is a polite way of putting it. My instructions was find a cure. Don't report that up to now have not yet found a cure. And we have seen this, and advocates have explained this. If you had AIDS, it was a death sentence. You would be dead in 5 years at the most. And this is actual scientific data. The situation was very desperate indeed. One of the presenters here has said she partook of the soil to treat her HIV. It was a very desperate situation. There was a riot. Police had to go and control the crowds who were actually getting soil as HIV treatment in the Sebambure district. And the Ministry of Health, incredibly, sent experts to try and find out whether, in fact, soil had any effect of HIV. Incredibly, but that is how desperate the situation was. But a turning point came. At that time, I wrote 2 books, and I've got a chapter, one called Non-Stop Funerals. Villages were funerals everywhere, and because people were dying, and as one of the very good presenter, the youthful lady explained, if you are told AIDS, it meant a death sentence. But a turning point came in 1995. David Ho and other scientists presented data the next year, 1996, in Vancouver. I was there. As they presented their data, which showed that AIDS could be treated and become no longer a death sentence, you could have had a pin drop. It was standing room only. Everybody had come to witness a miracle whereby AIDS cure. At that time, it was a cure because they said if you treated it long enough and be very vigilant, AIDS could be cured by the new treatment. We have since found out that was not the case, but imagine at the time. The most disappointing thing, I appeared on Canadian TV and they asked me, what do you think about the new treatment? Considering that it costs so much and your countries cannot afford it. And yet, your countries have got the biggest number of people dying. The most disappointing thing was that Africa was not to get access to this highly successful treatment. There were various excuses that the drugs were too sophisticated, but the most incredible thing that happened, someone who should have known better, addressing US Congress, said that the drugs require precision timing in order to work, and that the Africans cannot tell time. They rely on the sun, and I shudder to think what would happen to them on a rainy day when they cannot determine what time it was so that they take their drugs. And then someone whom I describe as a sadist went beyond that and said at the Vancouver conference that in fact, forget about these drugs. Africa is quite hopeless. If treatment was just a glass of clean water, Africa would not afford it. This is what I call a sadist. But someone went beyond that, because you can think that nothing can be sadder than that. Project started with funding which they could not give for HIV treatment, to get the drugs, to provide drinking water. And this drinking water was being provided in clay pots, and the project started. Clay pots in Kawempe project, clay pots in Bundubujo, clay pots in Kavari. That this was the only solution for HIV. But don't blame them. You know, you may feel emotional and say, oh, these people were crazy, these people were what? But the situation was really very serious. The situation was absolutely serious. There were huge numbers of people dying, millions. And the cost of the drugs were beyond even the combined budget of the entire African continent to provide these drugs. Infrastructure that was required was enormous. Care providers, as at that time they imagined the treatment would need, were not available, and logistics that were involved were quite a big challenge. I went around the world. Thank you to people who helped me to do so, to counter those who said treatment could not be availed. This was a slide that I showed at every conference, at every meeting that I attended. And to go back to that question of how is it that you are so confident that treatment can be provided in Africa, my answer was very simple. We are doing it. And when I said we are doing it, the meeting closed. It didn't close because it was over. They wanted to check this information out. And they gave me an explanation that the information that you are giving us might result in a policy or announcement of the President of the United States. The President of the United States does not take unproven theories. And they asked me to stay in Washington for a week. And when we met, a week later, we had been, Jcrc, myself had been thoroughly checked out. And we have found that what we had said were true. And this is part of what Tony Fauci is. This was the evidence then. We had established 3 satellite centers in the districts, so we had proven treatment was not only possible in Kampala, it could be done in the districts. But by 2001, and this was without aid, we had already established 10. Part of the money we are getting came from the research that we are doing. But that year, which was 2002, we had a model which we had developed at Jcrc. And this model was simple but very practical. It addressed where the location was, starting from Kampala to the remotest, and infrastructure starting from Mulago to no infrastructure. It had services being provided, there was nothing. And each and every section had a solution. We had it absolutely worked out. And we called it the network model. So, President Bush, a man whom I got to know personally, I had privilege of being in a room, just the two of us. I found him, this is my own impression, a very compassionate man. This is not something that anybody told me, bushes like this or what. No. This is something that I observed, me and him in a room. He called me Doc. And I called him Mr. President. Then it was me and Tony Fauci. Finally, a week before the State of the Union, we were having our office in the White House. Every day we started working from 6 a.m. to 6 p.m. And we are working on something that I knew actually, but had put up a very big pretense that I didn't actually know what was going on, because they had warned me, don't breathe a word on what is going on here. And I couldn't breathe a word. But anyway, on the day of this State of the Union, as usual, the day before, Tony Fauci told me, he said, Peter, tomorrow come dressed in a business suit. I looked at myself. I had a business suit all the time I was in the White House. I couldn't dare go to the White House without a business suit. Now he was telling me, tomorrow, come dressed in a business suit. I looked at my suit, and it was the best that I had. And I didn't have much money. The board didn't give me much money to, anyway, no money to cater for those. But I had a credit card. So I went to Fellini's. Americans know Fellini's. They have the basement store. The basement are those clothes which they are actually getting rid of. I checked, it's what and finally I found a suit there. And that is the one I was wearing on that occasion. I keep it as a souvenir because it was historical. Then, I'm not going to go into the details. Then we got this gentleman as the first Pepfar coordinator. His name was Randy Tobias. He's a guy who used to head a pharmaceutical company, who used to sell drugs at excessive price. But this man, his heart, when he understood what AIDS was all about, his mind mellowed. He became one of the greatest advocates for treatment of AIDS and supported the program with all his heart. So, when I left Washington, I arrived, but I was a very ignorant man as far as the American regulations and protocols are concerned. When I arrived, these guys had told me, you need to prepare, start. And they gave me a warning. Look, this whole program has been based on the promise that you people are already doing this. And it would be terrible if the program announced by United States President flops. So you have a responsibility to demonstrate success. So I came back sober, understanding the enormity of the problem. I was humbled. So we had to get a strategy. Believe me, someone talked about stigma, but the stigma about AIDS which was there in the country was incredible. You could not get people to come in the sort of numbers. I was telling the president's advisors that we will mobilize hundreds of thousands of people within no time. The president needed success demonstrated. But when we came, we had to get a strategy. So that's when we thought of TREAT and brought our network model in play. But we had to go to the villages. If you said someone had AIDS, people in the village still had great stigma. At Jcrc in Mengo, where we operated, people started avoiding passing by the gate in case they were mistaken as going for HIV treatment. Stigma was enormous. So people feared people would not come to our clinics. So we started all centers with a bank, a very big bank. We organized parades, we organized dances. It was a spectacle in the village. We had loudspeakers going around talking about Jcrc, but what was really made it very successful, what really helped us to succeed, we had dignitaries with us. U.S. Ambassador Jimmy Coker walked with us. He was on the parade on many occasions. People from USAID, Bob Cunan, Amy Cunningham, and others marched with us. Then, when we were in Bunyoro, we had the Queen, Her Majesty, the Queen of Bunyoro, herself, marching with us. So people said, well, big people are now taking part in this function. So stigma was lessened. To prove that, immediately after the march, the clinic would open the very next day, and our clinics were swarmed with people who came to get treatment. While we did all of that, we established regional centers of excellence in every province of the country, and the tests that were said to be impossible were now being done in every region of the country. And people had said they could not even be done in Kampala. Someone called, the Bible called a doubting Thomas, still didn't believe we were doing these things correctly. And he was a very important scientist here in Uganda. He came to my office and said, Peter, we have so many samples available with us, so can you do these samples for us? I said, absolutely. This was business for us. This is where we got all our money. Then he said, but we don't want you to do them in Kampala. I started seeing a bit of red. So I said, where do you want them done? He chose the remotest laboratory, and he said, that's where we want you to do those tests. We did the tests. We gave him the results, and about 3 months later, when we were having a light moment, he said, Peter, you passed the test. Your results from your remotest laboratory, as you described it, was as good as those done by CDC in the US. We have seen this. We covered the country. And this picture, you have seen it. This was US Ambassador. He had his plane, and I was on board that plane. We are heading to Kabong, and I shot this picture from the window of his plane. This is a village in Karamoja. The US ambassador wanted to see with his own eyes whether it was true that we are actually treating people in the remotest part of Uganda. You saw him getting out of that Manyata, and this was my turn to get out. I was following him. You had to be brought to your knees, and inside was seated the Karamajong chief, who told the ambassador and myself stories about how AIDS had killed his people and how our programs were helping them. And these were the Karamojong mothers with their children, all of them living with HIV, who had already started getting treatment in our clinic. They gave a presents to the US ambassador. Among the presents was a he goat, a very big he goat, and another one was a spear. And the US ambassador tried out the Karamojong weapon, this time hopefully aimed at HIV. We have heard about the infrastructure. And this was one of the things that we had with that Gang of Four to talk about in Washington. Paul Farmer said, and I had been to his center in Kanj, that these drugs can be delivered anywhere. So we would arrive in a place, there would be absolutely no infrastructure. And like we happened in Mubende, and we would come with a tent, put it up, and by next week it would be full of people in full use. Most of our staff were counselors, and treatment would be following the next day. And talking of infrastructures, we developed more permanent infrastructure. It's not that we sent people to go and build. We went and actually participated in building some of these infrastructures. And this is how our Mubende Center came out at the end of the day. And the question came, can this be applied to other resource-constrained countries? Because Pepfar was not about Uganda. It was about the whole world. Africa being the chief, because it had 90% of the people with HIV. And again, with my advocacy slide, I was saying, yes, Jcrc became World Health Organization knowledge hub for Eastern Central Africa for capacity building and scaling up HIV responses to be able to work with other African countries. We shared our experiences. I was asked to go to Kenya, and I had to forfeit my holiday. Actually, I never took a holiday until at the very end of my work with Jcrc. I used my holiday to go to Kenya, and we used our model to set up a network, how it would work in Kenya. Then we had a network coordinated at Joint Clinical Research Center that covered virtually all countries in East and Central Africa, the Sub-Saharan Africa. And this was called African Dialogue on AIDS. Part of it was funded by Rockefeller Foundation. We set up the network model on the continental stage. Then I was asked to go to Haiti. And working with a team, we set up a network model in Haiti. The Haitians, close to the giant country of US and South America, couldn't believe how that this program is working in Africa. Thanks to USAID, they funded them to come, and they saw with their eyes that it was being implemented here. And they went and implemented the network model that we set up with them in Haiti. So, the success of Pepfar. Need I really say more? It became America's biggest humanitarian mission to Africa. Its success extended beyond treating merely HIV. You had a presentation of someone who started with the TB. It included TB and malaria. It improved working conditions for staff in the Ministry of Health, Dr. Lalo. And thanks to the Ministry of Health for their support, we couldn't have done this work. So with all of this success, what would really go wrong? Everything was on track. Patients were being treated. Death had come down. Children's drugs had been developed. So what could go wrong? Actually, something did go wrong. Very seriously wrong. United States was hit by a financial crisis. Then here in Africa, Caribbean, anywhere Pepfar was, things just fell apart. It was incredible that such a successful program, which was rising to this level of success, where people had started talking of AIDS deaths as things of the past, that within a mere period of 6 months, things just fell apart and people started dying. All new Pepfar activities were frozen. And we are told not to, I still have a letter. Bureaucrats all over the world write letters. Cease and desist from recruiting any new patients. Any new patient you recruit on treatment will be at your personal expense. Pepfar will no longer support this. We are stuck. We had queues of patients, chaos. Patients, organizations, and my colleagues will bear me out, had been competing to get as many patients as possible. And they often asked us, because we had so many, can we take some of your patients? And the answer was yes, because they were providing quality treatment. All of these organizations, the partners we have here, they were giving quality treatment. But all of these were no more. So I went to ask, what do we do with so many people? They said, just send them to the Ministry of Health hospitals. But Ministry of Health hospitals had no facilities. It was a disaster. This was a Ugandan newspaper. It was a crisis. And this was between 2009 and 2010. Then I went on a new advocacy mission again. I met new officials of President Obama in the West Wing of the White House. And I met health committees of Congress and Senate. I got huge support from activists from US, and we actually raised a lot of concern by what was beginning to happen in Africa. New excuses had come again. It was no longer the question of HIV treatment being impossible in Africa. Now the new question was, we can't treat our way through the epidemic because too many people are affected. It is just impossible mission. And this was my slide, which I was showing again at all of those meetings, that we have no alternative. We must continue to fight the epidemic, and the support must not cease. Fast forward, Pepfar survived the crisis. I remember getting the first letter after the harsh one that I had got. It was from USAID. And it said, Dr. Mujenyi and your Jcrc can now start recruiting patients. I celebrated that day, and I think those who celebrated even more were the patients who were desperate for treatment. So as I conclude, country director, representative, please take our message. Thank your organization, USAID, and American people in one way or another for the gift of Pepfar. I have it on high authority from World Health Organization that at least 25 people are alive now because of your aid. Thank you. But for you Jcrc colleagues and partners, someone was saying here that people like me got accolades and what because they were there to be there. And that is true, and thank you for being there, because it was all of this was for you. But Jcrc made a major contribution towards the success of Pepfar. Now we look to the future. This is, I think, the very last slide. We look to the future. The epidemic is not over. And we have heard testimonies of children now being infected once again. And Pepfar is facing a challenge. 2 weeks ago, I was called, not in the Fauci fashion that I described at the beginning, but by public radio in the US, public radio service and TV, to go to the US because there was challenges of people who were fighting Pepfar. I don't think those people are malicious. Some of them have ideological reasons. Others really don't understand how important this was. So there are new challenges, but my hope is that since Pepfar has overcome previous challenges, that it will also overcome this one. But remember, it's not over. So what is the final solution? The final solution is to end the epidemic. We cannot be there 50 years and additional with the... You saw what COVID did. It came and caused the shock. We need to end this epidemic, and there are methods of doing it. And secondly, we are a country, a proud country, Uganda. And the message, my colleague, my brother, Dr. Lalo, is to ask people in government that we need to build our capacity. We need to build our own resources so that people can have confidence in us as we move towards a journey of eventual self-sustainability. But while we are moving to that journey, our partners should always remember that they will make it easier if they stick with us on this last lap of fighting HIV/AIDS. Thank you very much, ladies and gentlemen.
Another round of applause. As he comes down, I think I just want to request we raise just for 1 minute to just give honor to the people who did the architect of Pepfar. And yes, we appreciate the 4 gentlemen for the wise counsel and all the guidance that you provided, and for standing firm that we can actually do it. Kindly get seated. We are going to listen to a presentation from Robert Cunain, the Director of Health and Education at USAID, who was the Director of Health and Education at USAID from 2002 to 2005, and also hear his contribution. Just 1 minute, a few minutes. The texting.
I am honored to join you today to give some remarks on the important occasion to recognize and celebrate the 20 years of Jcrc Pepfar collaboration. Peter and Sissy, thank you for inviting me and for your leadership, compassion, and commitment to provide the highest quality of ARV treatment to Ugandan citizens. It was Jcrc that pioneered and documented that ARV treatment could be effectively delivered in sub-Saharan Africa, which inspired the leadership of the National Institutes of Health of the United States to ultimately gain the support of President George W. Bush and craft the legislation for the President's emergency plan for AIDS relief. I was the director of USAID Uganda's Health and Education Office from 2002 to 2005. When I arrived, I was excited to see firsthand how and why Uganda was able to dramatically lower HIV infection rates compared to other African countries. Uganda showed that behavior change on a mass scale was possible through the implementation of the ABC approach: abstinence, being faithful, and condom use. However, what I learned from Uganda is that the response was far deeper than ABC. It was a profound, broad recognition by Ugandan society of the social behaviors that exacerbated the spread of HIV. This was only possible because of an outspoken agreement amongst the political, religious, and scientific community of Ugandans to confront the root behavioral causes of HIV head-on. It took courage to admit the human frailties that needed to be addressed with compassion and love. Thus, there was far more openness to accept HIV and AIDS and not blame or stigmatize those who suffered, but to embrace and support them. The positive environment allowed community-based organizations and religious institutions to reach many with prevention care and support services. Uganda was the first African country to establish an AIDS commission, the first to provide widespread access to HIV counseling and testing services through the AIDS Information Center, the first to offer care and support to people living with AIDS throughout the entire country through TASO, the first to educate the youth about sexual health through Straight Talk and the school health education program, the first to form an interreligious council of Christian and Muslim faiths to advance HIV care and prevention through those respective faith-based health organizations, and the first to pioneer ARV treatment, patient monitoring, and follow-up through Jcrc. Localization is now an important approach among the international development community. It was Uganda that showed the power of localization to combat this devastating health and social problem over 20 years ago. Despite this concerted national effort, in 2003, AIDS was still a major health and social problem. I remember asking the members of the USAID health team, made up of about 18 Ugandans, how many orphans they had taken into their families, and the answer was 23 in total. Uganda was facing a major problem of far too many children that had lost one or both parents. HIV infection rates were going down, but still much too high to achieve epidemic control, and many were still dying from AIDS. A limited number of TASO staff working at their headquarters were getting ARV treatment due to the generosity of Bono, of the Irish band U2, to the amount of $40,000 per year. Jcrc could provide ARV treatment, but it was mainly confined to those only enrolled in its research activity. Otherwise, Ugandans living with HIV had no access to life-saving treatment. It was October 2002 when USAID Uganda decided to cancel a health sector procurement for an international partner. We agreed that the money could be better spent funding Ugandan organizations to scale up HIV/AIDS and related health services. Pepfar was not yet announced, but we sensed that more funding would be forthcoming to address HIV and AIDS. By canceling the procurement, it freed up seed funding to expand ARV treatments should U.S. policy change. Fortunately, I received the green light from the USAID contracting office to go into discussions with Jcrc. And these discussions were principally with Peter and Sissy. And it was to gauge JCR's interest in partnering with USAID and expanding their ARV program, which would move them a little more out of the research realm. These early discussions between JCRC and USAID allowed for USAID to initiate a cooperative agreement to expand ARV treatment within a short period after President Bush announced the Pepfar program in January 2003. At the time, there was a lot of skepticism in the international health community that ARV treatment could not be mobilized in low-resource setting, especially where transport costs and disruptions to infrastructure are common. JCRC was more than ready to prove the doubters wrong. With its laboratory network that could provide state-of-the-art patient monitoring and identify drug resistance. JCRC also had a strong working relationship with the Ministry of Health and district health departments that provided a platform to rapidly expand access to ARV treatment by setting up HIV treatment sites in hospitals around the country. If I recall correctly, within the first year of funding, JCRC, in collaboration with the Ministry of Health, had enrolled 50,000 Ugandans into HIV treatment programs. This success exceeded expectations and reinforced the decision by President Bush to invest an unprecedented amount of U.S. taxpayer money to expand ARV treatment, primarily in low-income countries in Africa. This success is why Pepfar funding has been sustained for the past 20 years. Dr. Mujeni has many talents, but one you may not be aware of is that he can really keep a secret. I think perhaps even Sissy didn't know that Dr. Mujeni was invited by President Bush to be at the 2003 State of the Union address when he announced Pepfar. We were actually all a bit shocked when we saw Dr. Mujeni on TV standing next to Laura Bush getting a standing ovation in the U.S. Congress. The White House wanted the announcement to be a major event, so they asked everyone involved to keep it a secret, even during our few months of discussions about providing funds to expand the JCRC ARV treatment program. Peter didn't mention the upcoming announcement at all. Peter, you should have at least given us a hint that this might be coming. I'd like to close by giving a shout out to some of my USAID colleagues at the time who were all involved in helping Uganda address the HIV epidemic. Dan Wamanya, Andrew Chambadier, Elise Ayers, who unfortunately passed away at a young age, and Amy Cunningham. I would also like to acknowledge the leadership of the U.S. Ambassador to Uganda, Jimmy Coker, and to the USAID Mission Director, Vicky Moore. Dr. Peter Mujeni, you are a national treasure, a great gift to Uganda, but also to the broader health and scientific community. You have been instrumental in establishing JCRC and putting in place the foundation to prove that ARV treatment can be a reality when so many believed this was not possible. As you would be the first to...
Hey.
Thank you so much, Canon James. Just the two of us, as in Jcrc and the Pepfar. Just the two of us. Another round of applause to Canon James. Yeah, so at this point in time, we are going to receive a speech from the Acting Mission Director. And I'll take this opportunity and honor to invite her to give her remarks.
Thank you so very much. Good afternoon, everyone. Good afternoon. It's really hard to follow in the steps of Peter Munyengi after you gave us the history of where we've been and told us where we were before, but also where we might be going. It's really hard, but I have to say it was very inspirational. So thank you, truly. It's been an incredible journey. So ladies and gentlemen, partners, colleagues, and distinguished guests, good afternoon again. It is an honor and a privilege to join you in celebrating 20 years of partnership and collaboration between the Joint Clinical Research Center and the United States government through the President's Emergency Plan for AIDS Relief, or Pepfar. 20 years is a significant milestone. Congratulations to the Jcrc team, the Ministry of Health, and other government partners, private sector and development partners, communities, and other stakeholders who have been at the forefront of the fight against HIV/AIDS. Many in this room, and as we have heard, have or know someone who has been infected or affected by HIV/AIDS. Many of us can also probably remember what it was like 20 years ago. One of my trips to the field earlier this year, or maybe last year, one of my colleagues recalled how she and her university friends were so terrified as they watched their friends contract the disease and others die from it. She told me how they were so afraid to go get tested because it was a mark on your back every time you went, because you never knew what your results would look like and whether or not you'd be welcomed back on university campus. So Gloria, who talked about her experience at the university, I think many of your colleagues had that similar experience. Considered a death sentence, HIV/AIDS epidemic was devastating, wiping out families, ravaging communities, leaving children orphaned, and health systems overwhelmed. Earlier in my tenure here in Uganda, in early 2020, as then Wamanya, I think we heard from one of our colleagues, our former office directors here, talk about him. He was one of the pioneers in the HIV/AIDS fight, and I'm sure some of my colleagues at Jcrc remember him. I don't know whether you remember him fondly, but I believe you guys worked very closely together during those early times. He was a relentless negotiator who helped, along with Amy Cunningham and others, make this partnership possible. And so as he was getting ready to retire, I was doing his final debrief to really get a sense of what his experience had been with the US government and what we could learn from the best practices and perhaps areas where we needed to improve. And so when I asked him about his greatest achievement during his 20 years with the US government, he did not hesitate. He said to me, it was a positive impact, our collective efforts, and the funding support from Pepfar that had on the lives of many Ugandans who are living longer and living healthier lives. As we have heard in 2003, then US President Bush launched Pepfar, and shortly after that, Jcrc received the first Pepfar grant in the world through the TREAT project, which helped HIV-positive individuals access life-saving treatment and bring hope to Uganda. Jcrc success was immediate. It was also no surprise. I think we've also, earlier today when we did the walk around, but also from Peter Munyengi, the whole experience. Jcrc had been there from the very beginning. Jcrc was the undeniable partner for the US government. It was the right partner for the US government, and it was the partner at the right time. So thank you for your leadership and for stepping up to take on this challenge. Thank you to the Jcrc team. And again, a special thank you to Dr. Peter Munyengi for steering the ship forward and to Dr. Sise Chito, sorry, I'm butchering your name, for continuing this important work. As many have said earlier, the baby has grown, and I think we can all agree that the baby is now a successful adult who's doing big things. Jcrc's early success gave us confidence that treating HIV/AIDS in Uganda and other parts of the world will work and even surpass expectations. It set the direction for the United States government Pepfar programming in Uganda and other countries. Since then, Pepfar has helped save lives, prevent infections, and accelerate progress towards control. For Uganda, we estimate that more than 490,000 HIV infections and more than 580,000 HIV-related deaths have been prevented with Pepfar support. These numbers represent people who are thriving today. People like William Mutovu we heard from earlier today, people like Gloria, and people like Flavia, and people like our colleagues from the Stigmaless troop, whose compelling stories underscore the power of resilience, underscore the power of belief, and underscore the power of second chances. I am inspired by their courage and for their desire to pay it forward through their advocacy work, for the call to action from Flavia, and their continued community engagement to educate, to reduce stigma and discrimination, and to encourage their friends, their families, their peers to seek services. In Lango, Chigezi, and Luboa, Jcrc, in partnership with Pepfar, is currently serving approximately 150,000 patients, like William, like Gloria, like Flavia. This is through USAID's local partner health services activity and CDC's project for strengthening public health laboratory systems in Uganda. In addition, with support from the US government, Jcrc continues to perform important activities like developing long-acting HIV treatment and conducting gene therapy research as part of the search for an HIV cure. So Dr. Peter Mugengi, we have not given up. Jcrc has also contributed to pivotal changes like generating evidence for the test and treat policy and providing laboratory testing for drug resistance to guide person-centered care to ensure those on treatment remain healthy. The extensive partnership and impactful work of this collaboration between Jcrc and the US government has been incredible. These contributions and those of many of you in the room today and in the communities throughout Uganda are what has positioned Uganda to be moving towards epidemic control. So as we gear up to this next phase of our fight, let's reflect and remember the achievements like these don't happen overnight or in a vacuum. They require investments, both in time and resources, as well as persistence, resilience, and if I dare to say, a bit of ingenuity. For the last 20 years, since the launch of Pepfar, we have collectively worked tirelessly to design and implement programs that address the needs of HIV-affected and infected individuals. Some were successful, and that others were not so successful. We have invested in research and development and collaborated with communities, organizations like Jcrc, universities, scientists around the globe on vaccines, therapeutics, and new approaches to service delivery. We have challenged ourselves, and in the words of one science fiction writer called Arthur Clarke, who said, "To discover the limits of the possible, we must go beyond them into the impossible." The truth of the matter is, as public health professionals and researchers, we are always learning, we are always testing the limits of the possible, because public health issues are complex, they are multidimensional, and they are dynamic. They require us to be open-minded, They require us to work together and to collaborate with different actors. They require us to innovate, to strive for excellence, and to hold each other accountable, and more importantly, to be compassionate. Values that have guided and continue to guide Jcrc and this partnership. And these values are at the core of Jcrc's success. So kudos to you again. As I close my remarks, I would like to take this opportunity to thank the leadership team and staff of Jcrc, past and present, for your unwavering commitment, for your conviction, and for your pioneering. Your work continues to save lives and bring hope to countless Ugandans as we work to end HIV as a public health threat. You have inspired people like William to believe and to join forces to fight HIV/AIDS. What you have done and the contributions you have made to the field of science and to the HIV/AIDS response cannot be easily quantified. The United States government is proud of all that you have accomplished, of the journey we've been together on, and look forward to a future that is HIV/AIDS free. Once again, my heartfelt congratulations on this milestone. Thank you.
Thank you so much, Danielle, for recognizing Jcrc for the hard work and for the continued support. And for also recognizing that Jcrc was an undeniable partner for USAID, and we still commit to do so and continue to work. Even as we be successful adults, we still need your support and shall continue to commit to the mission. Yeah, so it's this point that we want to recognize people who have supported. David, bring the certificate. Supported. Yeah. And I also request Dr. Sisi and the board chair to come over. No, it's okay. It's fine. So we are going to recognize people who have supported this journey. And we will start with the Professor Peter Mujenyi. And the message is, as we celebrate our journey of 20 years of collaboration with Pepfar, we would like to extend our heartfelt gratitude to you for your unwavering support and being a leader in the fight against HIV/AIDS in our dear motherland, Uganda. Your dedication has saved lives, brought hope, and empowered communities. Thank you for your remarkable and exceptional commitment and partnership. We look forward to your continuous support. Together we stride towards an HIV/AIDS free future. Thank you so much, Professor. Put me another. Thank you so much. Yeah, picture. Thank you so much. We would also want to recognize the Minister of Health. We don't operate in vacuum. We seek our guidance and support from Minister of Health. And I will request a doctor to come and receive. Yeah. Thank you so much, Dr. Ola. Thank you so much. And we want also to recognize the U.S. mission for this support. I think I'll invite delegates from the mission to come and stand with the Danielle to receive this recognition. Thank you. Wrap up with that speech. Thank you, the U.S. mission. If it wasn't for you, I don't think we would have Pepfar, and I don't think we would have all this success we've been talking about. So we want also to recognize some of our patients who've been with us and supported the work. And I'll read, this is our message for you. Your remarkable efforts in combating HIV/AIDS stigma and shaping Uganda's response to the epidemic are truly commendable. Your dedication has uplifted countless lives, breaking down barriers and fostering understanding. Your leadership as an advocate in destigmatization of HIV/AIDS has brought us essential conversations leading to improved health care, access, and better policies. Your work is inspiration, showcasing the power of empathy and action. Jcrc owes a debt of gratitude for your unwavering commitment to this cause. Your legacy will continue to drive change and create a brighter future for those affected by HIV/AIDS. Thank you for being a beacon of hope and a catalyst of transformation. And this is going to be awarded to William Matovu. Moses Supercharger, you should also get forward. Thank you for the advocacy. Thank you for spearheading change. And yes. Moses? Thank you, Moses. Thank you, William. This is for Moses Nsubuga Aka Supercharger. Flavia Chomkama, thank you so much for being a true advocate. Flavia Chomkama, thank you for being a true advocate. And Gloria, our baby, our beauty. Thank you. And we want many more to come out to be advocates. Our baby, our queen, our beauty. Yes. Thank you, Flavia. Yes. So as we celebrate this 20-year collaboration of Jcrc and Pepfar, we want to cement this partnership with a signature on this board. And we know that the mission is part of this journey, Ministry of Health is part of the journey, and of course the board that gives us strategic direction. Please, Dr. Sisi and Danielle. So we'll start with a signature from Danielle, and this is to cement the partnership and the journey we've moved for the 20 years of partnership of Jcrc and the Pepfar Foundation. Minister of Health, Doctor who is representing Dr. Ruth Chen, he will sign on behalf of Minister of Health. Thank you, Doctor, for the support and the guidance provided to strengthen this partnership. The board, we want to appreciate your strategic guidance. If it wasn't for you, management cannot do its work. Thank you so much for steering us well. For the able leadership of our executive director, thank you so much for giving us the guidance. Thank you. And we celebrate this partnership of 20 years between Jcrc and Pepfar. Thank you. So we'll just have a photo moment. A photo moment to celebrate the partnership. Thank you so much. It's indeed a celebration moment. Thank you, and you can get seated. Thank you so much. A round of applause for that moment. As we get the close of this event, I think I'll now invite the representative from Ministry of Health to give us his remarks. Dr. Charles Olaro. Please welcome with me, Dr. Charles Olaro. Thank you.
Thank you, Director of Ceremonies, the Acting Mission Director, the Pepfar Country Coordinator, the USAID team represented here, the CDC representatives, the Chair of Jcrc Board of Trustees, and the Executive Director and all the team, the Principal of Makerere College of Medicine, Health Sciences, all dignitaries. Let me stand on the already existing protocol. Ladies and gentlemen, first I stand here to represent the Honorable Minister. That's why you saw that I was hesitant to sign, because I don't know her signature, because I didn't want to, having taken that I was trying to pretend to be herself. The second observation which I had, okay, this stand had been moved away on the side of the flags, but I think the communication team noted that I was actually going to complain that I also needed to be at the center to represent really a true partnership for this country. First, I want to applaud and recognize Professor Peter Mugenyi. I will make some remarks before I read the speech of the minister. And then also I want to recognize really the Acting Mission Director for really the representation for this partnership. I've had the privilege of working, first being a student who was taught by Professor Mugenyi when he had a bit of stint in teaching in Makerere University. So I'm one of his students. I want first share my own experience when I was in Arua working as the medical superintendent and then finally a director when we were just rolling up the ARVs. And I think that time it was a CD4 count of less than 200. And you had all these many patients, but the ARVs that time actually were few. So I remember in the beginning we wanted to say start to do certain cohorts, and then now you have all this list of patients, definitely some with Kaposi sarcoma, others with the cancers, and then you are trying to select whom would you give. It was a very difficult question. But also when the ARVs had just come, there was already also a lot of myths where people were saying that if you take it, then you probably will do what? You will die faster. So we recruited this number of patients, and definitely they were doing very well. So those other ones who were hesitant initially, now it look like the people who started treatment actually are not dying. Actually, they're surviving. They are doing very well. So it'd be good that when we are celebrating the 20 years of partnership, Professor Mugenyi himself is actually here to speak about it. I had a stink to work with Jcrc, not as their staff, but as a partner in Fort Photo Center of Excellency. And we were able to provide care before we transition to sustain. So, Professor, this journey cannot be told without you, and really would want to applaud you once more. So at this point in time, allow me to bring you the speech of the Minister. I bring you greetings from the Honorable Minister, Dr. Jane Ruth Acheng. She's in Botswana for the WHO regional meeting, and she couldn't be here. The Permanent Secretary has been on the Western axis. She was in Kaso, then in Barara, launching the third wave of the mosquito net, which again we're working with Pepfar and the Global Fund, with the Global Fund support. So we would want to bring the greetings from the entire Ministry of Health, and they would have loved to be here. They would really have been wanted to be here, present, but were not able to do that. So accept that apology. We are very happy to be part of this event, where Jcrc is celebrating 20 years of Pepfar collaborations. 20 years is not a short time, and for you to be able to have that confidence, it means that Jcrc did the job and did it very well. Because if they did not do it, then probably the partnership could have ended somewhere. So I'm sure that the way the partnership was sustained is because Jcrc, with the able leadership, with all the staff, with definitely all the beneficiaries, you did this job very well, and you're able to be able to show the evidence. The Joint Clinical Research Center has been pivotal in guiding HIV and TB policies in Uganda through their pioneering research and clinical practice. They have conducted groundbreaking research on ARV treatment back in the early 90s, and the Ministry of Health has collaborated closely and translated this to research findings to policy to improve HIV and TB care in the country. Jcrc has been instrumental to set up and roll out HIV care, treatment, and support services. So if you look already, the map which we have shown, I think in one of the structures there, is literally, those are still our high volume centers. So the basis, both for the clinics and the laboratories, all of them started with the Jcrc. The infant diagnosis program through the same referral system, which provided the leverage for the current expanded program countrywide. The immense work done from 2003 when Jcrc rolled antiretroviral treatment under Pepfar, you said treatment, the program to the current local partner health services, that's the Kabale and the Lango, all have contributed in saving lives. And as you saw that the graphs in the initial stages of HIV epidemic were all going upwards, but all this trend has been changed. I think as a country, what remains us to do is that how can we get all the people who are out there into treatment and care as we work towards the 2030 as ending the epidemic. Because I am looking at that, when that pocket continues being out there, it definitely continues being a spoiler. You will not be able to achieve what's done. It will look like you are working, but you are not working. So really we need to be able to see that how can we be able to get the missing people, get them to care, and then work on the sad 95 that they are suppressing. So if we are able to achieve that, then we will be able to see that we've been able to sustain what has been started by Peter Mugenyi and colleagues. Leave alone that even today we've also heard that Peter Mugenyi knows how to keep secrets, but I think now there are no more secrets, so he really will be able to show that the evidence is already out there and everybody can see. So Jcrc runs one of the largest and the oldest HIV clinics in Uganda with about over 13,000 clients, and under their various projects, including USAID, the Kabale and the IDI and Lango projects, there are currently over 160,000 clients in the ART. This no mean achievement is quite a big number. They have been instrumental in running the HIV resistance and third line in HIV management program. And I want to thank Sisi. She's always, when we meet in the CCM, when there are issues of stocks regarding the third line, is always raise that issue because she has to take care of this special group. So we've been able to build capacity and decentralize it of the program so that as a country, even up to the level of health center free, you can be able to access what? Access care and access treatment. We also take note, I think that's the other aspect, the other assignment which we have is really to be able to screen for cancer of the cervix of all our patients, but even those who are outside care. I think that remains one of the things which we have to be able to push. So currently the regional referral hospitals are able to run the third line program with the minimum mentorship and support from the national teams. Because previously everybody had to get to Jcrc, but now we can run this differently. So as we commemorate the 20 years of Jcrc Pepfar collaboration as a Ministry of Health, we would want to applaud the following. We would want to applaud Pepfar for funding the USAID CDC has enabled the achievements of saving life. So if we did mathematics, there are some things in an equation that you cannot remove Pepfar from whatever success which you have what we have achieved. So let's applaud Pepfar for that. I think that's not good enough because actually they are here listening. That's better. I want to thank Jcrc leadership, both the past and present. Let's again also clap for them. And so those who are coming in the future, I think those who have already been there and those who are there already showing you where you should do. But in leadership, which I must say I've been one of them, one of the key issues is that if you look at Peter and Sisi, they are already an encyclopedia of leadership. So when you come, you already have references. So you don't need to get any other, probably buy a book from the bookshop to read about leadership. You just need to get to them and Sisi, and they do the mentorship, and you'll be able to be a best leader. So really, that's free, and I don't think they will charge you for that. The beneficiaries of the services provided at various service delivery points, especially the persons living with HIV, the research has done, which has informed the roadmap that has got us where we are, and the findings have made it possible for us to scale the number of interventions, both for prevention and treatment. As a ministry, we pride in the partnership we have with Jcrc and Pepfar since its inception, and as we move towards 2030, which is the timeline for the UNAIDS targets for 95 of persons living with HIV to know their status, 95 to be diagnosed, and 95 for treatment. I am looking at us, whereas those percentages I've set, but I think we shouldn't settle for less. we should actually be able to surpass them. So that's what we should be able to work. So let's look at that. And as I want to emphasize that, let's look at the third 95. Let's get people suppressed. So Supersurgery has told us here, let's be able to reach people with messages so that when they get the medicines, take it appropriately, and they will be able to achieve the best results. The celebration is worthwhile, but should be able to energize us to prepare for the last miles. This calls for implementing the interventions that work to scale with the desired fidelity to bridge the service gaps in finding new HIV cases, as I have indicated, initiated and retained on treatment. As I end, I would like to appeal to all our funders, especially the American government, to continue supporting us as we re-strategize to achieve the epidemic control. Congratulations, Joint Research Center, management and staff, and all our clients, for God and my country.
All right, thank you very much, Dr. Charles. And please carry our warm greetings to Dr. Ruth Acheng. Ladies and gentlemen, thank you very much for honoring this event, and thank you for blessing us with your presence and the testimonies, the very nice presentations. Dr. Mujenyi, Professor Mujenyi, I must say that you're such a blessing and a very good national asset. Ladies and gentlemen, enough has been said. Allow me invite Supercharger with his team. And then after Supercharger with his team, we shall invite the Canaan Gents, and we call it a day. Thank you very much.
Stigmaless band. Stigmaless band. Ladies and gentlemen, we are going to perform 2 songs, but each will take 2 minutes. The first one is called Together. The first one is called Together, Younger and Adults. We got to stop HIV infection. Know your status. Go for early treatment and adhere to all the treatment rules. And the second one is the Pepfar song, but this time round I want to dance together with you and the Pepfar team, because there is no party without dancing, isn't it? We need to, Give us the song quickly. The first one, ready? Stigmaless. Let's go. Freestyle. DJ, you've got to be adherent this time round. Together.
Together,
Younger and the elders, we gotta stop HIV infections. Know your status, go for early treatment, and adhere to all the treatment rules. Together.
together,
Younger and the elders, we gotta stop HIV infections. Know your status, go for early treatment, and adhere to all the treatment rules.
I was born living with HIV, no stigma, no denial. I feel good, I feel strong, living positively
To all the treatment rules. One more time. Together, younger and the elders, we gotta stop HIV infections. Know your status, go for early treatment, and adhere to all the treatment. Eva.
I'm a person born with the virus.
I got a message to all lovely mothers who are planning to have healthy babies. You got a role to stop new infections. You take a test, treatment is prevention. I am mama, 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 I am mama. Together, younger and the elders, we gotta stop HIV infections. Know your status, go for early treatment, and adhere to all the treatments. Gloria. Together, younger and the elders, we gotta stop HIV infection. Know your status, go for early treatment, and adhere to all the treatments. I am mama. One more time. I am mama. I am mama. I am mama. I am. Try imbalu. Try imbalu. I am mama. I am mama. I am mama. I am mama. Together, younger and the elders, we gotta stop HIV infections. Know your status, go for early treatment, and adhere to all the treatment rules. Look at these beautiful boys and girls. In 2000, when I met them, they were like 4 years. With the support from Professor Peter Mujenya and Dr. Sisechitio, we set up this team. But every time I look at them, I'm like, my God, you are great. God is good. Kati akaimba kantugena kadam, but I request you to dance with us. Please, if you love Pepfar. Okay, if only those people who love Pepfar. You're okay to stay if you don't love Pepfar. But if you love Pepfar, stand up, dance together. Give us the song quickly. Pepfar, Pepfar tutasiza nnyo abasinga twandibadde bafu. We are proud of you, Pepfar, and American people, for the real love you give to my Africa. Gende Pepfar twagadde nnyo, Pepfar tutasiza nnyo abasinga twandibadde bafu. We are proud of you, Dr. Chitio, American people, for the real love you give to my Africa. Gende watukosa kate walidagala uliwoyita liwobe sika uligwanga awo Pepfar nezara okutasa baba talina dagala namuwera ki Pepfar muzira waffe katsakanye abakulu n'abato tuli unpredictable twamira dagala twagadde nnyo Pepfar tulabiridde nnyo, Pepfar tutasiza nnyo abasinga twandibadde bafu. We are proud of you, Pepfar, and American people, for the real love you give to my Africa. Robina bambi okututasa endwadde zinnawookera ezireetebwa immune suppressing aterina mutwanyi. With you we can access our daily medication, and that's the God-given HIV drug resistant. Tulekanga wo Pepfar gwe bulamu bwange mpamira nnyo bambi ng'amagye amasiike mukwano w'embamuwe Pepfar empewo tefuuwa bwagala nnyo bambi ng'omunya omuzungu sakanye abakulu n'abato tuli unpredictable twamirira ddagala Pepfar. American people, for the real love you give to my Africa. We are proud of you, Pepfar, and American people, for the real love you give to my Africa. Now I know you all love Pepfar. Thank you so much. Thank you so much. May God bless you.
Thank you very much, Supercharger and the team. We really appreciate. That's a message to Pepfar, and I am sure you'll deliver the message. Ladies and gentlemen, next on stage, Canon Gents. Then after, I assure you lunch is ready. Please don't leave. Feel at home.
Hello everyone. Before we do our last set of performance, I want to introduce our team real quick. My name is Samuel. I'm an actor, commercial model, and a marketer. I'm sure you see people that look alike. The twin brothers are twins. So right here is Elisha Makisa, and next to him is Elijah Makisa. Both are Christians. And the father is Geoffrey. Geoffrey is a civil engineer. Then I also have a namesake, the name of Obama Fazil. He's a businessman. He's so happy to be with you, just as a business. So for this one, I'll be celebrating 20 years, and there's no better way to do it than do it along with it in Africa, and that to be specific. Enjoy.
Zembia moluna kuwasanyu Nambe mbiba molu yembalu nyimire
So I happen to be the saxophone of the group,
when my namesake is not holding the saxophone. So I'm going to do Great Is Thy Faithfulness, but in a vocal saxophone. So in a nutshell, I'm a human saxophone. Be blessed. So I want to introduce Fazil to take us through with a session, and then we'll come to crown it up. Thank you. Okay. This one, I think all of us remember it from our childhood days. It's quite a nice one and a common one. You will love it. Here we go, on the way. We go, on the way. Whoa, yeah. Woo, on the way. On the way, are we? On the way, in the jungle, the mighty jungle, the lion sleeps tonight. In the jungle, the quiet jungle, the lion sleeps tonight. Are we? On the way, are we? On the way, I say, hush, my darling, don't cry, my baby. The lion sleeps tonight. I say, hush, my darling, don't cry, my baby. The lion sleeps tonight. Oh, we go on the way. Are we? On the way, we know, oh, yeah. Woo, we on the way. Whoa, woo, are we? On the way, are we? On the way, are we know it? 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 Thank you.
Thank you very much, Canon James. Ladies and gentlemen, you still want more or we? The last on the agenda is the photo moment. But before the photo moment, Edie, I would love to invite you, because we have something from the AIDS Commission. And I would love you to come and receive it. Please.
Thank you, Edie. MC. Good afternoon, ladies and gentlemen. I'm called Dr. Byamukama Daniel. I come in from the Uganda AIDS Commission, sent by the Director General, Dr. Nelson Sova, who sends you greetings. And before I give you what he asked me to give you, I will say like one or two words. The first one is that we recently hosted a guest at the Uganda AIDS Commission who has authored a book. It's called To End a Plague. To End a Plague, America's Fight to End AIDS in Africa. She's called Emily Bass or something like that. So as we had a conversation with her, she told us a tale of Professor Peter Mjenyi and Jcrc. So the Peter Mjenyi we talk about is Peter Mjenyi, the physician. But she told us a story of a Peter Mjenyi, an activist, a schemer,
who really dared so many things to get ARV treatment here. I was totally impressed by your conquests. She tells a rich story. She has a very big book, as big as the Bible. I was forced to buy that book because there's a part of response that we didn't know. She told us about your conquests, your efforts beyond being a physician, an activist. So we want, from the conversation, it came out that we have not thanked Peter Mjenyi enough. We have not thanked enough, and I ask people to clap for you. We have not thanked Peter Mjenyi enough. And I'll read that book, and since I work for the commission, I will make sure I create an opportunity to thank Peter Mjenyi enough. Because I will read that book, because she gave us a glimpse of the story of what went behind the scenes to get ARV vibrant, available to Africans. Secondly, when the DG received the invitation, we did not keep it within our corridors. We started moving around, and the first person he told was the Speaker of Parliament. So when he had the audience with the Speaker of Parliament, he took the opportunity to inform the Speaker of Parliament about Jcrc, about the Executive Director, about the former Director, Peter Mjenyi, about all the work, your journey. He narrated the journey and the contribution you have made. And the Speaker was inspired and wrote a certificate of recognition, which he asked me to come and present to you today. And I think that's why the MC asked me to come and take a picture with you so I can take it back to the Speaker that I delivered. Thank you. So this is a certificate from the Speaker herself.
So this is a certificate of recognition. This certificate is presented to Joint Clinical Research Center in appreciation of the illustrious, selfless, and pivotal contribution to the fight against HIV and AIDS in Uganda, signed by Right Honorable Anita Annette Among, Speaker of Parliament, and Honorable Adolf Mwesige Kasaija, Clerk to Parliament, and Honorable Sarah Kayaji Netalisile, Chairperson, Committee on HIV AIDS and Related Matters. So.
Thank you. That's all I had to do. I was not asked to give a speech. Thank you for accepting this. Thank you.
Great. Thank you very much. And please, you please go to
Okay, group moment, photo moment. I think we are going to have 4 group pictures. We're going to have the group 1 as the US mission delegates, the board and ED, 1 group photo. I think we have it down here. Make sure the 2 flags are able to be seen. And yeah. Yes, please. Yes, here. Second one. Second one. It is the moment. We want to have this in our archive. It's a memorable day. We can have it here? Yes. Coming next. It's done. Second one, Professor Mjenyi, kindly join, and the team also still remains. And the Minister of Health, kindly join. Second one. Thank you. Okay. Okay. Are we done? The third is the Pepfar beneficiaries. Kindly come and stand behind. Plus Stigma Band. I think you can also come and join. The Jcrc team, get ready. Yeah, strong enough. Yeah. Are you able to get all of us? Thank you to Pepfar. Thank you, Pepfar. Okay, the senior management team at Jcrc, you can come and stand behind. I think you can get off the first, yeah. Senior management team, everyone at Jcrc, that table, please come forward. Unfortunately, I'm missing out of the picture.
And then finally, the ED, Professor Mjenyi, the US mission, and the MCs. Thank you very much.
Really? Thank you, and we shall close with a national anthem. Can we raise up? Check. Are we ready? Okay. Oh, Uganda, the body we lay our future in thy hand. United, free for liberty, together we all raise sun. Thank you so much for coming. We can have and go and enjoy lunch. As you move out, you pick a coupon. Thank you so much for coming, and thank you for celebrating with us, Jcrc. Yes. So the co-MC will lead the delegates from the US mission, to be followed by the table with the ED and the chair, the board.